Welcome back to another episode of Drug Talk. In today's video, I'm going to go over 3 things you should be aware of before using Omeprazole or Losec. Number 1, when you start using Omeprazole, you may experience gastrointestinal side effects. Most of these GI side effects are not common. They seem to happen less than 5% of the time because Omeprazole or Losec is generally very well tolerated. However, I'll go over each of these GI side effects and their corresponding percentages. One of the more common of these GI side effects is abdominal pain. This seems to happen right around 5% of the time. Less common are things like constipation or the regurgitation of gastric acid. Both of these side effects seem to occur in about 2% of patients. I just mentioned that constipation is a possibility, but actually diarrhea is more common. This can happen in about 4% of patients. Similar to diarrhea, nausea also happens 4% of the time. And the last 2 gastrointestinal side effects to watch out for while you're using Omeprazole or Losec would be flatulence and vomiting. These seem to happen at a rate of about 3%. The important thing to know about these gastrointestinal side effects, like many of the other side effects of this medication, is that they typically only occur in the early phase of therapy. After some time on the medication, when your body actually gets used to the medication, many of these side effects will go away. Having said that though, in some patients, these side effects will rarely persist and cause the patient to either stop the medication altogether or maybe ask their provider to switch to another medication in this class of proton pump inhibitors or PPIs. The idea of switching to another medication in this class would really be to see if you have a better tolerance with these side effects with that new medication. Number 2. One serious side effect to watch out for is Clostridium difficile diarrhea. So I mentioned just now that diarrhea is a possibility and seems to occur in about 4% of patients. However, Clostridium difficile diarrhea is something different altogether and is considered much more serious. Clostridium difficile, or more commonly known as C. diff, is a very contagious bacterium that causes diarrhea and colitis. It often affects people who have recently taken or are still taking antibiotics. This would be antibiotics that kill other bacteria in your gut, but don't kill C. difficile or C. diff, allowing C. diff to grow out of control. So how do you know if you have C. diff? What kind of symptoms will you experience? C. diff is typically characterized by very watery diarrhea, fever, and a loss of appetite. Some patients who have C. diff may also experience nausea or abdominal pain or tenderness. So if you're experiencing a multitude of these side effects together, it would be a good idea while taking Omeprazole to be checked out by your provider. If these symptoms are severe, it's advisable to be checked out again by your provider or maybe even in the ER as soon as possible. So keep in mind that this is a rare side effect of long-term use of Omeprazole or Losec. It's really just something that you want to be knowledgeable about. So if you do experience these side effects, you can take the appropriate action. Just keep in mind that typically this does occur, like I said, when patients are using antibiotics, not just Omeprazole. And number 3, some patients who use Omeprazole may experience neurologic side effects. Similar to the GI side effects we discussed in the first point, these side effects are not overly common. The most common in this group of neurologic side effects seems to be headache. That can happen up to 7% of the time. 2 other possibilities in this group of side effects would be dizziness or asthenia, which means abnormal weakness. These 2 side effects, the dizziness and that weakness, are quite rare. They only seem to happen about 2% of the time. Again, for many of these side effects, like we mentioned before, they seem to only happen in the early phase of therapy when your body's still getting used to the medication, so be sure to give the medication a fair chance before you ask your provider to switch to another proton pump inhibitor, or PPI, or stop the medication altogether. That's all we're going to talk about today with Omeprazole or Losec, but before you take off, I wanted to let you know you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.